This is the Let's Go Healthcare e-presentation. Hello from Portland, Maine, and the home office of Let's Go. I'm Dr. Tori Rogers. I am the director of Let's Go and the Kids Co-op at the Barbara Bush Children's Hospital at Maine Medical Center. Over the last decade, I have focused my efforts on combating the childhood obesity epidemic. I am also involved in a number of national organizations and programs working on childhood obesity. Upon the completion of this presentation, an audience member will be aware of the obesity epidemic, understand the Let's Go model for child obesity prevention, know the role of the healthcare provider dealing with obesity prevention, and have access to resources to be a Let's Go healthcare site. In the past 30 years, the percentage of overweight children ages 6 to 11 has nearly tripled. Additionally, today's youth may be the first generation to have a shorter life expectancy than their parents. This slide depicts the obesity trends among U.S. adults from 1990 to 2008. You can see how the epidemic has spread across the U.S., with the states going from light blue, less than 10% of adults being obese, to darker red, which depicts greater than 30% of the population being obese. The prevalence of obesity among U.S. children and adolescents has followed the same trend, revealing in 2007 to 2008, 10% of children ages 2 to 5 were reported obese, almost 20% of children ages 6 to 11 were reported as obese, and close to 18% of the teens are reported as obese. The Maine Face of Obesity follows the same trends. 63% of Maine adults are overweight or obese. 28% of Maine kindergarten students are overweight or obese. 26% of Maine high school students aged 13 to 18 are overweight or obese. And this costs the state $147 billion of direct annual health care costs attributed to obesity. So how did we get here? Well, it's very simply an increase in energy in and a decrease in energy out. So when we talk about energy in, there are things like low-cost, high-calorie foods, an increase in portion size, an increase in consumption of soda and sugary drinks, and an increase in dining out. On the other side, we're not moving as much. We have more TV and screen time, there's been physical activity and recess cuts in schools, and the changing built environment has made it difficult for us to walk places. Let's take a look at this portion distortion slide. Over here on the left-hand side, we see 20 years ago the size of a bagel at 140 calories, 3 inches in diameter. On the right-hand side, you see what it looks like today, which is 350 calories and a 6-inch diameter. And that's a caloric difference of 210 calories. Now, it's lunchtime. Let's look at the spaghetti. So over here on the left-hand side, 20 years ago, the plate had a cup of spaghetti with sauce and 3 small meatballs at 500 calories. Today, it's now doubled in size, and again, it's more than double in caloric count. The difference? A whopping 525. So to top it off, you might want a soda to go with that spaghetti. So 20 years ago, a bottle of soda was 6.5 ounces and 85 calories. Today, the bottle contains 20 ounces and 3 times as many calories. These 3 examples added 900 calories to the day, and this is almost half of our caloric needs for the day. So why do we care about this? There are lots of reasons to care. We'll start with economics. As I've already mentioned before, it costs billions in healthcare costs, lost productivity, and disability. From a healthcare perspective, the excess weight and fat causes major illnesses in childhood, leading to major diseases in adulthood. From a national security point of view, and this is quite interesting, being overweight or obese is the leading medical reason why applicants fail to qualify for military service. So let me take a minute to talk about the healthcare consequences. When a child carries around excess weight, they are more susceptible to a myriad of health problems, and you can see them on the left-hand side of the screen. And if these conditions and diseases persist into adulthood, that causes the increased risk for many things like heart attack and stroke, cancer, gallbladder disease, kidney stones, osteoarthritis, and pregnancy complications. Solutions. What works? First off, as most of you know, prevention is much easier and cheaper than treatment. Communities coming together allows us all to have a role. We don't have to own it all, but we can all take a step in the right directions. Parents can send in healthy snacks for birthday celebrations. Teachers can use non-food rewards. School nutrition directors can use local foods in their cafeterias. Local after-school programs can get rid of unhealthy snacks in the vending machine. Head Start providers can limit juice consumption. Libraries can use story walks in their communities. And hospitals can model healthy eating in their cafeterias. And healthcare providers can provide consistent messaging to patients and support community efforts. Environmental changes are critical. We need to make sure the environment around us support the changes that are necessary. We need sidewalks and walking and biking trails. We need to get rid of unhealthy vending machines in schools and after-school places and snack shacks. And booster clubs need to think about offering healthier options. Fourth, policy changes are often needed to sustain these activities and environments that I've just mentioned. And lastly, we all need to take small steps in the right direction. Oftentimes, numerous small steps in the right direction have longer lasting effects than one big step. Let's Go uses a multi-sector approach to reach children and families where they live, learn, work, and play to reinforce the importance of healthy eating and physical activity. The 6 sectors are early childhood, schools, communities, workplace, after-school, and healthcare. This model for change is centered on 3 core principles. Changing environments and policies are keys to creating healthy places to support healthy choices. Consistent messaging across sectors is essential. And strategies are based on science and recommended by the medical community. Let's Go is based on the premise that if families are exposed to health promotion messages through several settings, and if those settings have policies and environments that support healthy choices, families will be more likely to adopt and maintain healthy behaviors in their daily lives. We use the consistent messaging of 5-2-1-0 every day. 5 or more fruits and vegetables, 2 hours or less of recreational screen time, and keeping the TV and computer out of the room the child sleeps in, and no screen time under the age of 2. 1 hour more of physical activity, and 0 sugary drinks, drinking more water and low-fat milk. Let's Go uses 10 evidence-based strategies to promote environmental and policy change to create healthy places for healthy people to thrive. Some examples are providing healthy choices for snacks and celebration at schools and limiting unhealthy choices, providing non-food rewards and after-school programs, and providing opportunities for children to get physically active every day in childcare settings. It's working. The more people are hearing 5-2-1-0, the more they remember it, and the more the behaviors are starting to change. I'd like to show you a couple examples of the data that we have collected over the last year. In 2011, 60 Let's Go sites reported implementing or sustaining those Let's Go strategies I just mentioned in most classrooms or system-wide in either early childhood programs or elementary schools or after-school programs. The most successful strategies across all 3 sectors are healthy choices for snacks and celebrations, encouraging water and low-fat milk, and discouraging the use of food as a reward. During the last 5 years, the overall awareness of the Let's Go initiative increased significantly among parents in Greater Portland, from 9% in 2007 to 47% in 2011. In 2011, over half of the parents in Greater Portland, 55%, were aware of the 5-2-1-0 health message, a significant increase from 14% in 2007. In 2011, parents' awareness of the 5-2-1-0 message increased dramatically to 86% when they were exposed to Let's Go in at least 3 settings. In 2011, nearly half of Greater Portland parents, 47%, correctly identified all 4 5-2-1-0 recommendations, a significant increase from 35% in 2007. In 2011, the proportion of parents who correctly identified all 4 components of the 5-2-1-0 message increased to 59%, with exposure to the Let's Go program in 3 or more settings. Now we'll get on to some behavior change. In 2011, Greater Portland parents were 63% more likely than in 2007 to report their children ate 5 or more servings of fruits and vegetables daily, and 18% more likely to report their child's daily recreational screen time was 2 hours or less. So what's happening in your community? Here's a picture of a family fitness night that was coordinated by Scott Pelletier, a middle school physical education teacher in MSAD 27, which is in Fort Kent. Students and their families had the opportunity to participate in Zumba, Dance Revolution, yoga, aerobics, extreme Pictionary, musical chairs, and We Fit and We Sport. Here's the early childhood setting. Todd Lynn in Saco was awarded a Let's Go mini grant, which they used to purchase child-sized serving utensils and bowls to help the children learn what an appropriate portion size is. They also wanted to help ensure kids were getting going in the morning with a healthy, balanced breakfast. So now they offer parents a very low-cost option that includes a low-sugar cereal, fruit, and white milk. They have even overhauled their menu to include healthier choices and theme days. In the after-school setting, the Boys and Girls Club of Southern Maine understood their significant role that the after-school environment can play in developing positive health behaviors in youth. They decided to take this role one step further and developed a set of nutritional guidelines that applied to food offered at the club and sold in the vending machines. So what does Let's Go Healthcare look like? We focus on educating primary care practices on childhood obesity. We provide access to educational opportunities, tools, and resources. The program is designed to help healthcare professionals work with patients and families around health behaviors such as healthy eating and physical activity. We work to emphasize the important role that healthcare professionals play in addressing the obesity epidemic. Their office is a credible location for these messages, and they, the clinicians, are important community partners. This is a table depicting the specifics of what we're asking of the clinicians in their offices. On the left-hand side is the basic level. We're asking offices to connect to their community by hanging a poster in their waiting room. We're then asking them to accurately weigh and measure patients by doing a body mass index, percentile, and weight classifications on patients that are more than 2 years of age. Third, we ask offices to have a respectful conversation around weight using the 5 to 10 Healthy Habits questionnaire. But wait, before you get going, there are a few things to consider. First off, you need a team to do this work, to help you do this work. Who's on it? Secondly, weight is a very charged issue. You need to have a conversation with the whole office before you begin this work. Third, the words you choose are very important. Fourth, focus should be on health and not weight. And fifth, role modeling is critical. Patients and families look to us in our office. Now I'd like to take you through those 5 points that I mentioned on the previous slide. First off, it takes a team. I'm sure you already know this, but it's really important to spend a minute on. Do you know how many people your patient comes in contact with when they come into your office? All of those people should play a role in the project. The flow of patients through offices are so unique. What may work in one office may cause a major disruption in another office. I personally think the front office staff is critical. This is a tool that we have used in many practices to engage the whole staff in working with Let's Go Healthcare. On the left-hand side of the table are the key discussion points that happen at different times of the visit. This is just a well child visit I'm talking about now. The right-hand side of the column are the resources in our toolkit which support the left-hand column. The fun starts in the middle. This is where your staff can work on what happens in your office. Some things to think about. Who greets the patient? What role can they play? Do they have the knowledge and the understanding of what we are trying to accomplish with Let's Go Healthcare? Does your office use a healthy habits questionnaire to guide to habits like healthy eating and physical activity and sleep? Who hands it out? Where does it go? Who measures the patients? Do they give the height and the weight and the BMI percentile to the patient? In many offices, this is where the conversation really gets started. What does a BMI percentile mean? Is my child obese? Those are some of the questions that a patient or a family might be asking. Does the clinician have the tools to look for the signs and symptoms of obesity? How can the conversation get started and finish in a well child visit? This tool will help you address many of those. Now I'd like to go on to the next topic. Weight is a very charged issue, and what I call it is it's our stuff. This isn't like asthma. If you have asthma, you may feel very comfortable talking about it and sharing your stories. If you are overweight, or if your staff is overweight, or may have disordered eating, or have a history of that, or a family member who may struggle with it, this whole issue may make you or your staff run for the hills, or worse, just ignore it. I think it's important to have a conversation with the whole staff to reinforce that it can be an uncomfortable topic, filled with very culturally sensitive behaviors and emotions and opinions. We need to allow the staff to explore their own experiences working with patients and families around weight issues. I think it's very important that patients can relate to your own struggles. We have heard from many patients that they often like to hear from staff a nurse, a doctor, the front office staff that may be struggling with how to eat healthy on a tight budget and how to eat healthy when they've got kids that are going to all different activities. I also want to talk about there can be very conflicting messages in your office, and this can be confusing and discourage a patient. Here's an example. You may have a nurse that is very empathetic to the patients and listens and offers empathy and a few words of support, but then the doc may walk in and may be very busy and just does the usual, very demonstrative, assertive, hey, why don't you just eat less and move more? It's just that simple. That difference that I just talked about between the nurse and the doctor can be very confusing for the patient. So when you're thinking about doing this work, thinking about how the nurses and the front office staff and the doc and the MAs, if they all can be using the same sorts of words, and I'll talk about that in a minute, but also the same sort of approach without a bias. So lastly, the fat bias still exists. There are many instances in schools and workplaces and healthcare where people who are heavy are discriminated against. You may want to explore some of these topics with your staff. So the words we use, as I mentioned earlier, this is so critically important. What words do you use right now? You might want to explore that with your staff. What words do you use as a nurse or as a clinician? Do you use the terms overweight, obesity, carrying extra weight? There are words that we may use for billing and algorithms, and words that will move patients toward behavior change. Switching the conversation from weight to health helps us to engage the patient and family in making behavior change. Motivational interviewing has been very successful engaging patients and families, and it's really fun. If you'd like to learn more about motivational interviewing, please contact us and we'll be happy to talk to you. So now let me give you a few examples. This first example is a patient who comes in who's underweight, less than the 5th percentile. So the first thing that I would do is I always ask, is it okay if we spend a few minutes talking to you or your child about weight today? It's so important to ask about this. You'll see this as we go through a couple of the examples for the overweight and the obese category. It's so important there. If a patient or a parent says, no, I'm not ready to talk about weight, you need to respect that and move on. You might want to say when they're ready to talk about weight, you'll be here for them. Okay, so now I've asked this patient, are they ready or willing to spend a few minutes talking about weight today? The next thing is I'm not going to say that they're underweight, but I might use a phrase something like this. Your child may not be getting enough calories every day. And then I'm going to switch from their whole weight onto health. And I do that by using the 5-10 Healthy Habits Questionnaire to focus on behaviors. I'll go over that in more detail in a minute. Let's go on to another example. This example is somebody who comes in for healthy weight. So again, I start off saying, is it okay if we spend a few minutes talking about you or your child's weight today? Because it's so important. If somebody's at a healthy weight, does not necessarily mean they're healthy. So how else are we going to figure out if they're healthy? Well, if they say it's okay that we're going to talk a little bit about the child's weight, I then quickly move to the Healthy Habits Questionnaire. And that questionnaire is going to go through things like the 5, 2, 1, 0, and other habits which will help tell me how healthy that child is. Now we're going to get into some fun examples. I shouldn't say fun, they're just a little more interesting to talk about. Now you've got a patient who comes in for a well child visit, and they're in the overweight category. So again, you start off with, is it okay if we spend a few minutes talking about you or your child's weight today? Again, I'm going to pause. If they say they're not ready for that, you need to respect it because this is a charged issue. Again, I would say things like, when you're ready to talk about I'm ready because I'm concerned there may be some issues here. So in this example, the mom or the dad or the child says, I'm ready to talk about it. So then I might say something like, your child may be carrying extra weight. It may not mean that she has extra fat, but she may be carrying extra weight. You can also say things like this extra weight may put them at risk for health issues like diabetes or heart disease. Then I quickly switch the conversation over to health and not weight. And I do that by using the 5-2-0 Healthy Habits Questionnaire. So the next example is somebody who comes into your office who's in the obese category. So again, we say, is it okay if we spend a few minutes talking about you or your child's weight today? And again, respecting their decision to decide to have this conversation. If they say yes, I might say something like this, you have put on more weight than you've grown tall over the last year. Or maybe say your child is carrying extra weight. Or may say things like your child may be at an unhealthy weight. Those are all terms that in focus groups, patients and families have said, yeah, that's an okay way to start a conversation. I then quickly go to the 5-2-10 Healthy Habits questionnaire because this focuses on behavior. So I've switched the conversation from weight, I've said something about weight, a statement, and then I've gone into the questionnaire, which helps talk about how much time they're spending in front of TV, how much sleep they're getting, how much breakfast. If a patient or parent asks if they are obese, I would answer that. Obesity is a medical term and doesn't always indicate the level of fat a person has. But yes, you are considered obese medically, and this puts you at risk for serious health conditions. But I don't think the most important thing to concentrate now on is the word obese. I think it's more important to concentrate on behaviors that you'd like to talk about today. So lastly, I'd like to get into role modeling. I think it's really important that we have an opportunity to role model in our office. But don't worry, you don't have to be at a healthy weight, and you don't have to eat only healthy foods. There are a few opportunities you might have in your office to try role modeling. Some things are no sugary drinks in your office, have water bottles out, getting rid of TV in the waiting room, having healthy snacks and celebrations, try using a pedometer, try even walking meetings. I've had a number of offices who have done this with patients and families that are coming back for a follow-up visit. It can be for anything, really. It could be for an ADHD follow-up visit, or it could be for a weight issue or whatever. They've taken the patient and family around the office outside and just had a walking discussion. It's a really neat way to think about working with patients and families. Let me show you an example of some of the tools that we have for your office. This is our sugar bottle display, which I think, as you can tell, has the liquid emptied out of the bottles and sugar replaced there. This is probably the most powerful visual tool that we have at Let's Go. And off on the left-hand side, you can see a clear bottle of water, which we think is a statement in its own. Okay, putting this back to work in your office. First of all, start small. Be patient with yourself and your team and the patients. Don't try to start a treatment program for obesity before you adequately address the basic steps. So, now back to the basics. We have 3 requirements to becoming a Let's Go healthcare site: connecting to your community and the Let's Go community efforts, accurately weighing and measuring patients, and having a respectful conversation around weight. Let's make these things come alive in your practice. So how to connect to your community? Well, the easiest thing is to use our 5-2-10 Let's Go poster. We're here to offer as many posters as you need for your office. You can put them in your waiting room, exam rooms, bathrooms, staff area, whatever makes sense for you. Secondly, we ask you to accurately weigh and measure patients and to determine BMI, BMI percentile, and weight classification for patients 2 years or older. From birth to age 2, it is recommended to use the weight for length measurement and watch for crossing percentiles. The third basic requirement is to have a respectful conversation around weight, again, realizing that this is a charged issue. So using the 5-2-10 Healthy Habits questionnaire, you can switch the conversation from weight to health. Here's an example of that questionnaire I know I've mentioned a lot today. This has 9 questions on here, asking the 5, 2, 1, 0, and a couple other key ones. The last thing here, in number 10, it says, based on your answers, is there one thing that you would like to help you or your child change? This one in front of you now is for age 2 to 9 that the patient fills out. That the parent fills out. This one, ages 10 to 18, is for the patient. So you might say, okay, Tori, we're already doing all these required components. Well, let me take you through a little more of the advanced components. So you say you're already hanging the poster? That's great. We'd like to connect you to the Let's Go community efforts that I mentioned earlier. There are work that's happening in your community in schools and after schools and childcare sites, and we'd like to connect you to that. Just call us up and we can let you know what's happening in your community. We'd also like you to be an advocate for healthy eating and active living by maybe presenting at school board meetings or child care organizations. We also can ask you to join the local, state, and national organizations that are already doing this advocacy work. So you say, yeah, Tori, I've been doing BMI and BMI percentile for a while. What else can I do? Well, there's a lot else that you can do. We think having planned visits for patients and families who are ready to make those next changes is really important. We have developed, and with collaboration with a national organization called NICHQ, we developed a guide called Next Steps. It's in the pilot stage, but it's based upon 17 theme visits. We're happy to talk to you more about this if this is something you'd like to do. Here's an example of those 17 themed visits that you can talk to when patients and families come back to you just to work on this. It's everything from understanding your health to eating and your emotions to portion sizes to screen time to reading food labels. We have resources and information around how to have those conversations. We're happy to talk to you about that. So let's say that you want to go a little deeper about having a respectful conversation around weight, that the questionnaire, that 5210 questionnaire just opened up the dialogue, but you might have been a little stymied at how to really work with patients and families. Using motivational interviewing techniques can really help you further understand how to engage patients and families. When I started using motivational techniques and learning more about it, it totally changed how I practice medicine. It really became fun. I started to listen more to my patients and families, and I actually learned a lot from them. Let's go develop a recognition program for sites meeting the basic level. To date, we have over 40 practices throughout Maine that have been recognized. So what do you receive if you get recognized? You receive a framed certificate, you're listed on our Let's Go website, and we'll send a letter to your practice senior leadership to tell them the great work you're doing. More importantly, you'll be connected to these other Let's Go sites in your community. We'll have Let's Go schools, Let's Go after school sites, and Let's Go childcare sites, and you can be part of the community that is creating healthy places for healthy people. Now, we've talked a lot about basic levels and advanced levels of Let's Go Healthcare, and we've talked about a recognition program. Let me talk to you a little bit about the tools and resources we have to help you get there. I know we've talked about a lot today, and thanks for staying with me. I hope you've come away with a clear understanding of what Let's Go Healthcare is, and we're here to help you, so please call us. I also want you to know you're not alone. Let's Go works throughout the state, from York County up to Aroostook. And working with Healthy Maine Partnerships and Health Systems, Let's Go has engaged 345 schools, 163 child care sites, 24 after-school programs, 28 school nutrition districts, and 65 healthcare practices. If you'd like to learn more how your practice can become our next Let's Go Healthcare practice, please call Brian Ryan at 207-662-4065 or send him an email. And please visit us on our website, letsgo.org.